I have been employed many years, and I recently have lost my job, and with it, the health insurance.
I wasn't prepared nor aware of what happens to people who aren't insured, and that was a real wake-up call for me.
These children and my sister and the families that I work with have problems, health problems, and they're going to end up in the emergency room. It's going to cost somebody a lot more money.
As a practitioner, you spend more time chasing the insurance dollar than you do giving quality care. And that's a problem, and that's going to continue to be a problem unless something changes.
One of the things I fear is that my daughter will get really ill, and my husband and I will be responsible for her care.
I got a letter from my insurance company a couple of weeks ago informing me that my insurance premiums went up $120. So now I pay $550 to insure myself and my son each month in a high deductible plan. And I went back and looked, and in 2001 I was paying $200 a month.
As being a nurse, I love what I do and I'm proud of what I do, but I also go home sometimes feeling like I'm part of a broken system and don't know how to fix it.
One of my statins, Lipitor, would be like $100 more, $150 a month or to get this. It's really expensive for my cholesterol, and my cholesterol is really high right now. And I am watching my diet and I am exercising, so I'm working on it, but I need that medicine. And 5 years down the line, I might have a heart attack, and that's kind of scary. So,
well, I feel that my story illuminates the fact that this can happen to anybody. Anybody can go from earning a very good income. I was in Hollywood making all these TV shows and some films, earning a six-figure income and able to take care of health care, and then one back injury, doing Pilates exercise of all things, and after a couple years the big money was gone, and I was living under the poverty line and often didn't have money for food and didn't know if I was going to be homeless, so healthcare didn't fit into that.
I've been insured my entire life since I was 18 years old, and I went through a 9-month period in which I was uninsured. I had changed jobs, went through a divorce, and I moved back home to California. And I had a gallstone stuck, and so my pancreas was being eaten away. And by the time I went to the emergency room, I ended up there for over 14 days on an IV. I had to have emergency gallbladder removal surgery. And while I was in the hospital, I was very concerned because I didn't have insurance and what was going to happen. I was a single mom of an autistic child. I already had a burden, and I didn't know how I was going to deal with this. And they kept on telling me not to worry, not to worry. Probably 11 days in, the hospital administrator finally comes to see me and lets me know that I have a bill of over $40,000 and would like to know how I'm going to pay for this. And I advised him that I'd been there since day one asking about this, and they gave me a stack of paperwork they wanted me to complete. And they asked me if I would figure out how to pay for this before I left, whether I was putting it on a credit card or some kind of form. And I advised them I wasn't going to be signing anything because they had not explained my rights and what I was able to do or not do by law. And I ended up being sued for it. I lost my house. I lost almost everything, including my dignity. And nobody should ever have to go through something like that. Especially a single mom who's trying to do her best. It's just not right. So I think, even though you think it's not going to happen to you, or you're in optimal health, it does happen. And if it happens to one person, it happens to all of us. And that's important.
I'm unemployed. I'm a medicinal chemist, And I've had a wonderful career helping people by making medicine that help people like myself with it. But now I find myself unemployed due to a lot of different reasons. I won't go into that now. And I do not have health insurance. I had Cobra. It was costing me $550 a month, and I lasted a couple months, and on unemployment it just wasn't enough. My daughter's going to college. She's now doesn't have any health insurance either. She called me up the other day and said, "Daddy, am I still covered?" No, we're not. I really would like to see something more that is being done in Europe or in Canada. I know they've talked a lot about the negatives, but I think there's a lot more positives in the healthcare programs that are going on in other countries, especially towards prevention and early diagnostics and diagnose and kind of taking responsibility for your health, for your health early on, as opposed to waiting until you're really sick. I saw my mom. She died of liver failure. She had a liver transplant, and Kaiser, I hate to say names, but they kept her stringing along for 20 years on her disease until she was on her deathbed, and then they decided to give her a liver transplant, and it didn't work because she was already way too sick, and they spent $400,000, just amazing, $500,000 on her, and it didn't help. And if maybe they'd just done a little bit more earlier on, it would have given her a better quality of life, and it would have been cheaper. I just want to express to people, especially to our representatives, that there was an election, there was consequences, and I'm going to hold them responsible if we don't get things done.
Well, I was living in Hollywood and had very good work. I was editing and associate producing television shows, X-Men and the Mighty Morphin Power Rangers, had great insurance through Disney and then through the other companies. Was able to really take care of my health very well, even though I was working 2.5 jobs, so I needed the health care. And then at one point my health did go down, probably from overdoing the work, and I had a back injury. And from the back injury and trying to keep all the jobs going, I got Epstein-Barr, and then I had this whole list of like 10 illnesses. Ear infection went on for almost a year, and just a lot of pain. And I finally had to quit my job, and I went on disability for a while, and moved here to Cardiff from Hollywood to have a more peaceful place to recuperate. And I had Cobra for a little while. And I had money for a little while saved up, and then that just all went. And this was 14 years ago, and my health never quite got better, and I was no longer able to get any health care. I couldn't get insurance at first because of the conditions I had been diagnosed with, this whole long list. So I couldn't get like Blue Shield or Blue Cross. And then after that, I didn't have finances to get the health insurance, and my health wasn't really good enough to be out there working regular jobs. So what I did as a spiritual service oriented person, I created this website of hundreds of pages of free multimedia spiritual resources. I've written books, Spirituality for Dummies, and somehow all these things didn't bring in even any money, partially because I feel that spiritual things should be given as much as possible, but also the sales haven't been up. And so I've lived under the poverty line for these 14 years, and my knees since have gone bad, so now I can't walk very well. So it's hard to get exercise, and then you gain weight, and then your health goes down further. If I haven't been able to see a doctor when I needed it, if I got injured, I would try to take care of it myself. At one point I had a big shard of plastic go into my foot, and I tried to take care of it myself for over a month, and it was this big wound, and it wasn't healing. And I finally found a low-income place that charged like $30 to go there, and they were shocked because it was 2 inches deep in my foot, and they had to pack it and do all this stuff. But even then, I couldn't afford the ongoing treatments even there, So fortunately, that did heal, and fortunately, I'm still here and I'm okay. But I really look forward to healthcare being taken care of in this country, and I'm glad to be able to participate in this.
I feel very frustrated about this because I lead a very healthy lifestyle. I have not cost my insurance company a single penny in about 10 years. I've never gone over my deductible. I have to pay for any medication that I take, pay for all my tests, everything, and I don't reach my $2,400 deductible for me and $2,000 deductible for my son. And I'm concerned, I'm a little bit insecure as well because I know that this is all fine right now. I'm paying $6,000 a year for nothing, just to stay healthy, plus whatever I eat into my deductible. But I feel that if I were to have something catastrophic happen or a chronic illness, that my insurance company would not be there for me. They have been a company that in California has rescinded patients' insurance when they found pre-existing, little things on their application. And I know that they can raise my rates because I pay for this myself. I'm not with a group. I'm individually insured. And although I don't smoke, I get exercise, I eat healthily, I don't eat fast food. I just had my cholesterol and my blood screening checked here at this health fair. I'm fine. I feel like I'm paying for a lot of other people who either are not insured or are in the high risk pool here in California, where they're also paying crazy amounts, and it's just going to get worse. And it's like a tax that I am paying to private insurance companies that are paying their executives extremely well and are cherry picking, and I'm a cherry, and I don't like it. I want my congressperson to hear this, Brian Bilbray. I want the senators from the state of California to hear this. I think ordinary people who actually have good insurance right now should hear this, because there may come a day when they lose their job or their company decides it can no longer afford to pay insurance, and they will be in the same situation that I am, paying an arm and a leg for coverage that is not at all comprehensive. It's not even catastrophic. I would think if something bad happened to me, I would be bankrupt. It would bankrupt me very quickly, and that makes me feel very insecure, and I think it's a bad way to handle health insurance.
Health story that I want to tell today is about my sister. She has health problems. She's required a surgery to remove cysts from her uterus because it's causing her hemorrhage, very heavy hemorrhage, like 15 days out of the whole month. She went to the doctor, to the community clinic, and she doesn't have health insurance. So they told her that they couldn't do anything for her, and actually the doctor asked her if she had health insurance, and she said no. Then they said nothing that we can do. My sister offered to make get into a payment plan because she just didn't have $10,000. And they said that maybe next time, not this time. And we just can't do anything about it. We're just waiting for something worse to happen, and we don't know what we will do then. We don't have the money to pay $500 a month for her health insurance. She only makes $1,200 a month, and with $500 health insurance, there's no money for rent and food. It's not only her story, it's a lot of people that I know stories. I work I'm an assistant for the Healthy Families program, and I encounter people on a daily basis that sometimes, we end up crying together because they are suffering, and I do suffer with them. I want my representatives to hear this story because it's important, and you're there to represent us, and you need to do what we need to be done.
Just last week, I was treating a patient, and she was complaining of some heart fluttering symptoms, and I wanted her to go get a good cardio checkup, and she doesn't have health insurance, And she was very concerned about the cost and was very reticent about even seeking care. I see a lot of people who, in my opinion, seem to be over-medicated. You know, they only get a few minutes with their doctor. It's boom, 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 hit through the points, forget what they're coming in for or extra symptoms that could be a differential diagnosis. And the doctors a lot of times are so overwhelmed they can't find out the complete history. A lot of times people only have, even if they're covered by health insurance, let's say they're coming in for a physical therapy benefit, they run out of sessions before they have really healed, and they need more treatment. They need more physical therapy or pain relief treatment, and medication is going to cover the symptoms. It's like, you know, if your oil light goes off in the car, you can either unscrew the light bulb and take away, you know, what seems to be the symptom, but not really taking care of the problem. And so your car is eventually going to break down. Your body's eventually going to break down and create other problems. So I see a lot of symptom management, but not a lot of cause management, not a lot of root management.
My daughter, who's 26 now, was diagnosed with type 1 diabetes when she was 15. And for most of her life, she's been covered under her father's health insurance. But as soon as she got her college degree and went out to work for herself, she had to have a job that had group health insurance. And fortunately, she was able to find one. But it concerns me that if she doesn't have a job with group health insurance, she will never be able to buy any health insurance that will be reasonable for her. So if she loses her job or wants to find a different kind of job that doesn't have health insurance, she doesn't have many options. People that have pre-existing conditions cannot get decent health insurance. And it's not just in my own family, it's not just my daughter. I have 2 nephews that have chronic illnesses from childhood that will make them unable to also get insurance. So if I've got 3 in my family, I can only imagine how many more people would have the same conditions. So I think we need to have a government-sponsored option that gives these children, these kids, anyone, the ability to get decent health care. I've called both Dianne Feinstein and Barbara Boxer, and I think they support a public option, but the lawmakers that think that it's too expensive or it's not going to work are very short-sighted, I think, because it's going to be way more expensive if we don't do something about this now, if we wait and just let this get worse and worse.
I have recently applied for a private health insurance, and I was very shocked and disappointed that I was turned down, despite the fact that I am in good health. And I lead a healthy lifestyle. As you see, I'm in my jogging suit. I run every Saturday morning for a long distance, and an additional 2 times during the week I bike, I swim, I hike. I do even yoga. So I was very disappointed that this health insurance, and it's actually Blue Shield, turned me down and basically rejects me. They told me I have a high cholesterol. They told me that I had an unresolved urinary problem, and third, that I see a chiropractor once a week. My primary emotion is disappointment that I now belong to an outcast of a group of people who cannot get health insurance. Another emotion is hope. I really hope that our new president, Barack Obama, with our legislators, senators, congressmen, are now doing something for us, for those people who actually are even in a worse situation, who lose homes. I have savings. I'm not that bad off. I can pay for my health insurance, but again, I'm disappointed I can't get any insurance. And I feel even worse for those who lose their homes and who are not in a situation like I am, in a better situation like I am.
I had amazing, beautiful births with both my children, but I felt like I also just had to make it work within the system. It's going back to choice. I felt like my choice was taken away from me. I mean, there's a time constraint placed on a lot of women to have their babies because the hospital needs the bed for the next woman. So if she hasn't delivered in 2 hours, make sure she's got Pitocin going. Your charge nurse comes to you, why isn't she changed her cervix? What are you guys doing in here? And then a few hours later, either because the doctor, needs to get back to the office or we don't have any beds, she goes for a C-section. I just feel like there's a lot of medical intervention that's so unnecessary. And as I was doing research as a mom, too, about birthing, I just was appalled with the statistics of our infant and maternal mortality rates. And it is directly related from the intervention that we do. With a C-section rate as high as 31% in our country, I think women need to take a step back and find out if it's really for safety of the mom and baby. If they're really getting informed consent over the need for a C-section, if they've been given a reasonable amount of time to try labor, or if it's just that it's physician convenience, or they just aren't fitting into the stereotype of what the doctor thinks should happen in 2 hours or 4 hours or 6 hours, instead of just letting every woman's just so different and letting their body do what they're supposed to.
A lot of people call it health insurance, but I really don't call it health insurance because it's actually sick insurance. And I relate it to car insurance because when your car, to keep your car healthy, who pays for the oil changes? Who pays for the tire rotation? Who pays for all the maintenance on the car? You do, not your car insurance. So who pays for everything to keep your body healthy? You do, right? So when you break your arm or when your car breaks down, there's some mechanical failure, that's when insurance kicks in, and that's what it's good for. Some people may take offense to this, but I think it's the overwhelming American society of healthcare that drugs will cure all. And it's really not true because health doesn't come in a pill. I have a cousin who is a medical doctor, and he gets quotas on how many prescriptions he has to write a day. When that happens, you don't give the best possible care. So with all the medical training that everyone has, if you're being directed by a certain insurance company or a certain pharmaceutical company that you have to, write a certain number of prescriptions, and you see it every day. When you go to the doctor, how long does a medical doctor spend with you? Really? So if you walk in and they say, okay, great, here you go, right? Americans make up 5% of the world's population, but we use 50% of the manufactured drugs. And so I ask myself the question, if drugs were the answer to health, wouldn't we be the healthiest country? And where do we rank in health? We rank 42nd in health.
I'm just a regular guy that is in a tough situation.
This is a third world experience happening in a first world country, and it's just not right. We can do better.
It's a tax for me. I would rather pay the tax to the government and have a better health alternative, a public option, than to continue paying insane amounts of money to private insurers.
I don't know what the best answer would be, but I know that something needs to change in order for our society in general to wake up get healthy.
You do feel in America that you should be able to survive. You know, it shouldn't be that you're, you know, laying on the gutter outside and you don't have health care and you can't go to a doctor when you feel something's wrong.
No one should be without health insurance. We have a law that everybody has to have a car insurance. Why shouldn't we have a law that everybody has to health insurance?
We don't have the money and we don't have health insurance, so we were just sitting and waiting for us to die, I guess.